In today's discussion, one of the most contentious issues were around why Ministry of Health plans and continues to implement almost in silos from the rest of the local governments. As Ministry of Health also orients to the program-based planning for government as guided by the NDP3, we see that for community health, from the level of parish downwards, it's going to be implemented under the parish development model, under a pillar called Pillar 4, which is the social service pillar, where health, education, and water and Ministry of Water are. And that shows how Ministry of Health efforts towards integration and also multi-sectoral approach is really well laid. We actually appreciate that health is not only a Ministry of Health issue. When we look at the key direction, the key strategic direction of health, the way we say that we are now, we want to make a slight shift from predominantly disease identification, management and referral to now looking at the community drivers of health. You see that the community or the drivers of health are not only Ministry of Health. When you look at the life stages of the drivers, we find workplaces, you find education is a driver, and so many other things. And those things, we have sectors that lead on them, and so they need for us to work together. The other question was around more of how are we, the political people, participating? What's our role? I wish to state that when you open the community health strategy, you'll find that the governance and coordination structure of the community health strategy has two arms of governance and coordination. It has a technical arm, which is majorly Ministry of Health structures from national level through the facility, but it has a governance arm, which is a multi-sectoral arm. So when you look from the national level, let me start at the sub-national level. At district level, we have the Human Capital Development Committee, but also we have the Technical Planning Committee, which is managing the governance arm. And then you go to the sub-county, up to the parish development model, up to the LC1, managing or the governance of the community health interventions. So that shows how the strategy and how the new approach is putting in consideration the need to have us move as a team. That even when you're at community level, the LC1 being the leader, the chair for the village health committee or the village team, that this shows that it's not and the VHT or the community health work being the secretary shows how best we've tried to align within the multi-sectoral approach of implementing government programs and especially community health programs.